Hello everyone and welcome to my ultimate nose guide. This is going to cover literally everything you can do to fix your nose. Now obviously the main factor that is going to really change your nose is going to be a rhinoplasty, but I'm not here to talk about that. You already know that. What I'm going to talk about are the things you actually can change, right, to the most significant degree possible, right? And there's a lot of nuggets in here that people just do not talk about that I have experience with, so let's go ahead. So starting off, we have to start by defining what we're actually working with. So do we have inflammation? Do we have enlarged sebaceous glands? Do we have excess bloating or lymphatic fluid in our nose? Is the tightness of our skin about suboptimal? So we have to make a diagnosis to start out. You may have many of these, you may have one, right? So diagnosing this is pretty easy, right? So first of all, can you see the pores in your nose very clearly, right? Do you see blackheads, for example, just black spots? Is it very oily? Is there redness? Is there rosacea, right? Puffiness wise, is there consistent puffiness? Is there a lot of excess morning puffiness? Right, these are the questions we have to ask. And then as for determining, the difference between the actual cartilage and fluid, if that's the case, we want to actually compress it. You will be able to pretty clearly tell whether or not it's cartilage or fluid. It will compress and leave a slight indentation if it's fluid. If it's cartilage, you won't feel that at all. It'll just rebound. And it's not that soft. So, and then of course the allergies and rosacea, you have to mitigate that. High sodium, high alcohol nights. This is really important. You should not be drinking alcohol in the first place, or it's just a looks minimizer, okay? Alcohol is probably the worst substance you can take for your health, right? Especially long term. Uh, there are way better options, you guys, way better options. I'll talk about those later. And then skincare, like actively doing skincare, or are you using androgens as well? These can all have impacts, right? So this is where we make our diagnosis. So number one, we'll start with inflammation. Now, ivermectin 1% is going to be the best option for inflammation. Don't use hydrocortisone, don't use any of that bullshit. Ivermectin is the best, okay? Now, for the actual redness, right, we have to use a vasoconstrictor, so oxymetazoline, 1%. This is the best I've seen so far. And this will significantly help for that rosacea and excess redness. However, you have to consistently be using it, okay? And then, of course, just the basic stuff, avoiding the triggers. So, alcohol, spicy foods, excess sodium, even heat, right, can all impact the nose. So just avoiding those in general, especially the alcohol. I know people, want to use alcohol because it makes them lower their inhibition, but there are much better options, right? Example being something like pregabalin. Um, so there's just so many better options, and you're just destroying your health for slightly lower inhibition, which you should actually be training for in the first place. Like you should be getting experience to the point where you don't have to always self-medicate, basically. So I highly recommend you do that and start now. Okay, so now sebaceous glands and oily thick skin. So when we are talking about sebaceous glands, the best option is going to be oral isotretinoin, right? This is the best. It will, and here's the thing, you guys, you don't have to always be on isotretinoin. I know people don't like to always be on Accutane. It makes sense. There are real side effects, real consequences you can experience, even mental depressive side effects. The dry lips, you always get them. Pretty much everyone experiences that. It's a pain in the ass. But here's the thing. You can run Accutane for only like 4 months, right? You can discontinue and you still get the results. You will continue to have the reduced sebaceous gland size. No one talks about this, but even after you discontinue your Accutane, you will still have that benefit for up to 1, 2 years. Some people even permanently. So it's really something to consider. Just running a short Accutane cycle, basically, and boom, your nose is shrunk. You get less acne in general in the long run as well. So it's really a no-brainer in my opinion. And then we have the topical retinoids, of course, the tretinoin. This is really just for texture and then some skin thinning, just a slightly. And then here's something also no one talks about: RF microneedling. I have an RF microneedling device. I have multiple RF devices, but RF microneedling is very, very good, much more effective than you'd think. It's definitely helped with, I've noticed that's definitely helped with the skin, with the collagen and elastin especially. It definitely helped it look less bulky. I could definitely see a difference. And also it actually flushes out the glands. It can actually flush out the pores. UC does that as well, by the way, and I'll talk about that later. And then yeah, so targeting fat, right? So overall weight loss is going to help with this a ton, right? If you're overweight or obese, or even if you're just slightly above a healthy body fat percentage, but you still have excess nose fat, you should cut down. Okay, regardless, you should just at least try, right? Um, but if you're, you gotta lock in on that. Okay, lose the weight. It's really easy to do. You can even just use retatrutide, right? Take it at 4 to 8 milligrams a week, I'd say for most people, and you'll be fine, right? And a lot of creators like to praise fat dissolvers, and people even talk about using them for the nose. However, it's actually pretty suboptimal, very risky for the nose, right? So the reason being is because there's actually a very high chance of you getting skin necrosis from doing this, right? Which is actually when the tissue will die, right? This can happen for multiple reasons, mainly from something like an infection. Um, but the it's just not a safe thing to do. And also vessels, right? So the blood vessels, if you hit the blood vessels, you're putting actual acid into your nose. That'll spread around. If that damages the vessels, you can end up with permanently just a red nose, like just permanent red scarred nose. Like it will not look good. So it's really just not worth it in that regard. The risk to reward ratio is just not there. However, we can do UC, right? So using an ultrasonic device. This works, okay? This actually works. All you have to do is apply the proper gel. I have a whole community explaining how to do this properly, by the way. You need the proper gel, you need the proper device. It has to be a light device, preferably over 80,000 kilohertz. So if you want to learn how to do that, yeah, you can join the community, and I'll teach you how to safely do that. As for the lymph, the bloating, right? Uh, People won't really talk about this that much either. So you can actually get lymph bloat slash bloat in your nose, especially when you wake up. You'll probably notice it when you look in the mirror slightly. Um, and there's a couple things we can do here. So number one are just enzymes to thin the lymph if it's protein dense, which it can sometimes be. Especially if you've had inflammation in other regions or inflammation in the nose, or like invasive surgery possibly in a surrounding area. So using enzymes such as serrapeptase, for example, lumbrokinase, these can work to actually break down the proteins in the lymph fluid, thin the lymph, and then help it drain faster, right? And then all the lymph will go from your nose all the way right here to your submandibular nodes, and then eventually into your thoracic duct and your bloodstream, right? So that's what you want to do for that. Lifestyle wise, you should be pretty active, right? You should be walking at least quite a bit. Just light exercise is really the best for lymphatic fluid. Even rebounding, so literally just jumping up and down, can help pretty significantly in speeding up lymphatic drainage. And then MLD, so this is going to be manual lymphatic drainage, right? So there are tons of tutorials on YouTube. Basically, you have to use like an oil or a cream or something that can help you glide over the skin. Apply it, gently, very gently, move it towards the lymphatic exit points. There's tons of videos out there. I'll link one in the description on how to do this. And then as for the skin tightness and thickness, so yeah, the topical retinoids, of course, kind of ties in to what I already talked about, tretinoin. And then RF microneedling and fractional laser. So yeah, these both will have a pretty significant effect, especially the fractional laser therapy I've noticed. And then something else is sunscreen when you are being highly exposed to the sun, right? When you're out for very long periods of time, because you can get something called elastosis, and this looks really bad. It's almost like it looks like scar tissue almost, which is just an abnormal elastin. If you see people who as they age, especially who stay out in the sun a ton, like my grandpa, for example, he golfs a lot. he's outside a lot. His skin is all red, and you do see these little like spots of just abnormal elastin sticking out. It does not look good. It ruins all the smoothness and contour. And yeah, so this is pretty much it. This is literally everything you need to improve your nose. This is very comprehensive, the best materials you can use, best info you can use just to reduce your nose. And be realistic. I will say, be realistic with your expectations. Although these can go far, um, keep in mind it's not going to be like a rhinoplasty, right? You're not actually going to, upturn your nose or anything like that. Um, but they can help significantly with slimming, right? Especially if what you're dealing with isn't just a ton of cartilage. So yeah, if you want to learn how to do even more advanced looks maxing techniques, right? You want to spot reduce fat better. You want to use androgens to grow craniofacial bones. For some people, it doesn't work for everyone. You want to optimize your skin quality, your lifestyle factors, you improve your physique, frame height. All those I cover in the school, and pretty much everything else in nootropics. So if you're interested in that, consider joining, but only if you are dedicated. Okay, if you're just going to go in there and be scared of everything and just leave, I don't want you. Okay, so I hope this helps you guys, and I hope you're able to apply this information. So I'll see you later.